A local pediatrician who ended up hospitalized with the virus herself 1 year ago says opportunity is on the horizon.
Over the past 10 months, most of us had the chance to get vaccinated to protect ourselves and others from COVID-19. The one group excluded all this time, children. At your vaccination headquarters, we went looking for answers, and Emily Bloom has this doctor's message for parents.
Here at Kootenai Health, there are 5 kids hospitalized with COVID-19. They're between the ages of 10 and 18, and this is the most that we have seen hospitalized here so far. Dr. Charlotte Weeda, Chief Medical Officer and pediatrician, had an eye-opening experience in the fall of last year.
I didn't even realize what a big deal it was and how sick people were until I was hospitalized. And seeing the look on the nurses' faces or the doctors' faces when they were taking care of all these patients who were much sicker than me made me realize this is huge.
1 year later, she's advocating for the vaccine.
The vaccine is safe, the vaccine is effective.
She's eager for Pfizer's vaccine to be approved for kids between 5 and 11.
My job as a pediatrician is to give you the best advice and the best medical advice and the best scientific advice. And I think this is very safe for your child. I'll make sure my children get it when they're all of age and eligible.
The kids' vaccine is about 1/3 of the dose currently given to kids 12 and over. In the trials done so far, kids have had very little side effects, if any at all.
The viruses are super smart. They're way smarter than bacteria. So the longer they're in a community and the longer they have to spread, their main goal is to see how many people they can infect and how sick they can make people.
As we get more herd immunity, the mutation rate will decrease.
There's a lot of checks and balances with the immunizations as well. You have the ACIP, you have the CDC, all these people that meet together, the FDA, and then the state level as well has to approve it. So once the state levels have approved it, I'm sure it will not be a secret, and then parents can schedule their appointments.
And when the kids' vaccine is released, she anticipates most vaccination opportunities will be in a clinic.
It's also nice is you get your pediatric advice too, someone you've known and trusted for years.
She compares the vaccine to wearing a seatbelt.
People need to stick with science, and it's not an opinion, it's not an emotion.
Dr. Weeda hopes and anticipates that the Pfizer vaccine is approved for kids between 5 and 11 by early November. Reporting in Coeur d'Alene, Emily Bloom, 4 News Now.